Rhawn da, a chroeso cynnes iawn i bob un ohonoch chi un cyfarfod cyffredinol blynyddol ar gyfer y cyfnod Ebrill 2024 i Fawrth 2025. Ac yn unol â gofynion Llywodraeth Cymru, dyn ni'n cynnal ein cyfarfod blynyddol heddiw cyn ac erbyn ddiwedd mis Medi 2025. Os ga i gyflwyno yn hun i gychwyn, Carl Cooper ydw i, sef cadeirydd Bwrdd Iechyd Addysgu Powys, a dwi'n falch iawn ochr yn ochr a'n prif swyddog gweithredol Hayley Thomas o allu rannu efo chi ein hadroddiad blynyddol. It's a very great pleasure to welcome each and every one of you to this, our annual general meeting for the period of April 2024 to March 2025. And in line with Welsh Government requirements, we're holding our AGM by the end of September 2025. My name is Carl Cooper, and I am chair of Powys Teaching Health Board. And alongside our chief executive, Hayley Thomas, I'm very pleased today to be able to share with you our annual report for 24-25. Os ga i esbonio yn fras iawn, be di ein cyfrifoldeb ni fel bwrdd? Y bwrdd, wrth gwrs, ydy corff llywodraethu y Bwrdd Iechyd, ac mae'n cynnwys aelodau annibynnol, ochr yn ochr ac yn ogystal ag aelodau gweithredol. A chyda'n gilydd, dyn ni yn ffurfio y bwrdd unedol. Ac yn bennaf, mae gen ni 4 cyfrifoldeb. Yn gyntaf, dyn ni yma i osod cyfeiriad strategol ar gyfer y sefydliad. Yn ail, dyn ni yma i osod archwaith risg ac i fonitro ac i reoli risg yn erbyn yr amcenion strategol hynny. Yn drydydd, dyn ni yma i fonitro cyflawniad a pherfformiad yn erbyn ein hamcanion strategol. Ac yn bedwerydd, ac yn sicr nid yn lleia, achos mae hynny yn holl bwysig, dyn ni yma i osod naws a diwylliant y sefydliad. We are the board of Powys Teaching Health Board, and as such, we are the governing body of the organisation. We are comprised of both independent members and executive members, and together we form the unitary board. And what are our responsibilities? We have 4 main responsibilities as a board. First, we're here to set the strategic direction for the organisation. Second, we are responsible for setting, for managing risk within the organisation against the strategic aims of that strategic direction. Thirdly, we are to monitor delivery and performance against those strategic aims. And fourthly, and certainly not least, because it is of paramount importance, we are here to set the tone and culture of Powys Teaching Health Board. Ac fel y gwyddoch chi i gyd, mae wedi bod yn gyfnod heriol iawn i'r gwasanaeth iechyd, a di pethu ddim yn wahanol ym Mhawys. Ac mae ein hadroddiad blynyddol ni yn amlinellu meysydd pwysig o gynnydd sy'n adlewyrchu ysbryd cydgynhyrchu a phartneriaeth yma ym Mhawys. It has been a very challenging period for the NHS. And Powys isn't immune to that. We are no different. And our annual report outlines important areas of progress that I think reflects the spirit of co-production and partnership that we have here in our county. As we know, in 2023 and 2024, the World Health Organization made the official declaration of the end of the global emergency status as regards COVID. But The impacts of that period are still very, very keenly felt by patients and communities, by our staff and our partners, both in relation to the health and well-being impact, but also through unacceptably long waiting times that continue to be experienced for routine care. And these impacts are compounded by the socio-economic consequences of the ongoing conflict between Russia and Ukraine, the cost of living and the inflationary pressures, and a very challenging recruitment and retention environment, particularly affecting sectors such as domiciliary care. During 2024-25, we also saw ongoing industrial action in the NHS, both in Wales and in England, with a number of national pay disputes continuing through the year. However, notwithstanding these challenges, we've been able, as a health board, to continue our journey from pandemic response to a focus on medium to long-term strategic goals. And these are set out in our health and care strategy. And in a moment, I will invite our Chief Executive, Hayley, to take us through that year's journey. Given our financial position, as well as the continued work to recover waiting times, Welsh Government escalated our health board from level 3, so-called enhanced monitoring, to level 4, so-called targeted intervention for finance, strategy and planning. I think it's really important to outline here that we remained and we continue to remain in no escalation in routine arrangements for all other aspects of health board delivery. And our Director of Finance and Deputy Chief Executive, Pete Hopgood, in a few minutes will take us through our financial accounts, and that will just be later in this meeting. Also during 2024 and 25, as a board, we approved the implementation of some temporary service changes relating to our minor injury units, their opening times, and also how care and support is provided through our Ready to Go Home units. And our board took the decision in July of this year to extend the temporary changes, and these will form part of a public consultation as part of our Better Together programme, and that's planned for the autumn into the winter later this year in 2025. And I also take this opportunity to thank my board colleagues and indeed all members of staff from Powys Teaching Health Board for all the hard work that's reflected in this annual report in what has been a very challenging, but I have to say as well, a very rewarding year. And I hope what you'll see in Hayley's presentation is a reflection of the immense volume and high quality of work that takes place day in, day out across this health board in the service of the people of Powys. Dyn ni'n croesawu unrhyw gwestiynau gan aelodau'r cyhoedd, ac be dwi'n gofyn i chi, os ydych chi'n gwrando neu'n gwylio y darllediad yma heddiw, yw bod chi yn ychwanegu rhain at y bar cwestiynau ac atebion, a byddwn yn ymdrechu i ateb gymaint a phosib o gwestiynau ac y gallwn ni heddiw. We do welcome any questions from members of the public as part of this annual general meeting. Please do add these into the question and answer bar, and we will endeavour as much as we can to answer as many questions as possible today. You may be aware that we've started work on our Better Together programme, and this has included a period of engagement over the last 12 to 18 months with the public and our stakeholders about a variety of our community and mental health services. As a board, we will be considering proposals in October of this year, which will then be subject to public consultation later in the year. Now, given the work taking place is analysing all the engagement feedback and the development of possible options, we won't be spending too much time today on that Better Together programme, but please be assured that we as a board will consider the options in full in October. Felly da chi, postiwch unrhyw gwestiynau eraill sydd gennych chi i'r bwrdd yn y sgwrs cwestiynau ac atebion, ac edrychwn ymlaen at eu hateb. So please do post any other questions you have for us as a board in the Q&A facility, and we look forward to answering them. And so you will see on your screens now a slide that shows you who the members of the board are. So I just wanted, before I hand over to Hayley, just to highlight to you some changes that have taken place in our board over the past year. And I certainly want to thank those members that either have left us or are soon to leave us, and to welcome very warmly new colleagues that have joined us on the board. Ian Thomas joined us as an independent member. Elaine Lawton joined us as Executive Director of Primary and Community Care and Mental Health. Nicola Johnson came on board as Executive Director of Planning, Performance and Commissioning. And you'll also see Lucy Cornish there, who attends our board in a non-voting capacity, but as our new Director of Improvement and Transformation. And this slide, therefore, shows the membership of our board as it is today. And there have been a number of changes since the end of the financial year. Claire Roche recently announced her retirement as Executive Director of Nursing Quality, Women and Family Health, and we will be joined soon by Paul Hooton, her successor. And also, we are soon to say goodbye to Kirsty Williams, who leaves us to take up her appointment as Chair of Cardiff and Vale University Health Board, and the process for recruiting her successor is currently underway. I won't go into a lot of detail today, but suffice it to say that we feel deeply, deeply grateful and indebted to both Claire and to Kirsty for the invaluable contribution they have made to our board. Thank you. So I just want to very, very finally say that if anybody wants to know more about our board, then more information is available in the annual report in section 2, so please do look at that section. But without any further ado, I'm going to hand over to Hayley and to invite our Chief Executive to present the operational dimension to our annual report. Drosodd i chi, Hayley. Diolch yn fawr.
Diolch yn fawr. Before I start, if it's okay, I could ask Helen Bushell, our Director of Corporate Services, just to offer a little bit of a technical briefing for people who have joined the call. Thank you.
Diolch, Hayley. Thank you very much. Pnawn da, everybody. So today we are using Microsoft Town Hall as the digital software to support the delivery of our AGM. This offers you the opportunity to see live subtitles of today's meeting. You should see a button in your settings to switch on subtitles. Subtitles for today's meetings are available in Cymraeg and English, as well as Polish, Ukrainian and Urdu. Please note that these subtitles are generated automatically from spoken English. Sections of presentation given in Welsh will not produce correct subtitles, but the speaker will use both Welsh and English to ensure that nobody is excluded. Microsoft Teams Town Hall also allows the opportunity for you to raise any questions you may wish to ask of the board today. On your screen, as Carl said, you should see a tab with a question mark on it. This will normally be in the top right of your screen. If you click on this, it gives you the opportunity to ask questions by typing them into the bar. Please note that there is approximately a 1 to 2 minute delay on the live broadcast, so you may not see them appear immediately. Please accept our apologies that we may not be able to answer all of the questions during today's meetings, but we will continue to update our website with the latest information in answer to your questions, but also about the Health Board's plans and priorities. Today's meeting is also being recorded. Don't worry, this does not share information about you and the audience. Just the information you see broadcast on the screen today in front of you will be visible. This means that people who are not able to join this afternoon will still be able to watch today's AGM at a later date. Thank you again for joining, and Hayley, I'll hand back to you.
Thank you, Helen. A diolch yn fawr iawn am y cyfle I gyflwyno adroddiad blynyddol y Bwrdd Iechyd. Thank you. I'm delighted to be able to present our annual report for the year 2024 to 25. As we reflect on the year, I am really proud to share the progress and achievements of the Health Board in what has been a year of dedication and continued commitment by the team to safe, effective and compassionate care for the people of Powys. Our strategic vision for a healthy, caring Powys to help people live healthy and independent lives has remained at the heart of our work. And despite the continued increasing pressures on health and care systems across Wales and the United Kingdom, staff have demonstrated resilience, collaboration and creativity in addressing the needs of our population. During the last year, it's been a significant year where we have implemented a number of temporary service changes and also undertaken work against our Better Together programme to design and develop the future shape of safe, high-quality services for Powys. But first, I'd like to share a reminder of the ambitions we set for the year gone by. The health and care strategy that we developed with the people of Powys remains at the heart of how we respond to our challenges. As a reminder, we set the strategy in 2017 with much conversation with patients, public, staff and partners. And we're really pleased that it was a joint strategy across the Health Board, the local authority, PAVO and other partners. Clearly, the context has really changed since 2017, but we know that the principles and objectives in the strategy are standing the test of time. Throughout the year, we've continued to align our work with this vision, but also in line with the Welsh Government's refresh of A Healthier Wales, which was published in December of last year. And the strategic priorities at the heart of the strategy remain valid, and this means that our focus for the people of Powys continues to reflect on focus on well-being, early help and support, tackling the big four, joined up care through workforce futures, digital first, innovative environments, and of course transforming in partnership. These strategic priorities were then reflected in the goals that we set for last year, which are summarised in this plan on a page. Our annual report outlines the important areas of progress and also reflects the spirit of co-production and partnership here in Powys in order for us to deliver on our goals. I appreciate there is a lot of detail on this slide, so just to reassure you, this information is in our annual report, and also these slides that I'm presenting today will be available on our website. I know it's going to be impossible to cover all the great work delivered last year, but I'm going to attempt to highlight some key achievements. So first, you told us that access to NHS dental services is a key concern for our communities. We have a mobile dental clinic to help tackle gaps in dental provision across the county. And also we piloted in Powys a new dental access portal to make it easier to request NHS dental treatment so that we can allocate children as quickly as possible when new places become available, and then adults are allocated based on how long they have been waiting. This portal has now been rolled out across Wales, helping us to get a better understanding of dental need across the country. In Powys, we have 3,700 adults and 10 children who are currently waiting on the portal. And just some reassurance that our community dental service continues to deliver urgent dental appointments to support access, and we're continuing to expand the availability of urgent dental care so that you can get treatment in an emergency. We've also worked with Welsh Government on the dental contract reform, but we also recognise that there still remains a lot of work for us to do to address access to dental services across the county. You told us that you want it to be easier for your medical records and information to be shared between Powys community hospitals and the care you receive in district general hospitals outside the county. With the financial support from Welsh Government, we invested 1.7 million in the state-of-the-art X-ray equipment. As well as providing quicker results and more accurate diagnoses, the new machines will reduce waiting times for X-rays. We also know that the new machines also lower the dose of radiation that the patients are exposed to. And with the new digital equipment, we will also be able to connect our scan results with the National Radiology Information System so that your results are easier to access wherever you receive your care. And the work to connect this equipment to the national system is underway. You also told us that you wanted more opportunities for us to train for health careers. Our Aspiring Nurses programme continues to help us grow our own workforce, offering local people the opportunity to earn while they learn. Our aspiring nurses join us as healthcare support workers. They're trained on the job through our university partnerships, and then they work towards a career as a registered nurse once they qualify. At year end, 78 staff were being supported at different stages of their nurse degree programme, and our award-winning Aspiring Nurse programme continued to be a big priority for us. Alongside this, we've been delighted to continue to expand our international workforce. 31 internationally educated adult community nurses joined us, more than 3 times the number in the previous year. And alongside this, we were joined by 6 international mental health nurses. And I'd like to extend my thanks to the people across Powys who've made our overseas staff welcome, both in our hospitals and communities. And these, alongside other measures, are helping us to reduce the cost of agency nursing. It's also important to start early, and our Academy Careers Education and Enterprise Scheme has engaged with 5,500 learners during the academic year of 2024-25. We know that this helps to inspire young people in Powys to be the health and care professionals of our future. You told us also that you wanted easier access to mental health support when you need it. So we have continued with our implementation of a single point of access for mental health services. Our implementation of 111 Press 2 has been taken further than in other parts of Wales as a single point of contact for access to our services. And the CAMS Crisis Hub is also helping us to provide targeted support to young people in crisis. And we have a new modern community mental health hub established in Llandrindod. Given the challenges facing the NHS, and therefore for all of us as patients and residents, it can be easy to focus on the things that are not working as well as we would wish. But reflecting back on the year, I do want to make sure that we do justice to a few more achievements of our hardworking staff. Our teams have improved care coordination for frail individuals and end-of-life care planning, including clearer pathways for cellulitis and urinary tract infections. They led the way in Wales also in combining our integrated autism and attention deficit hyperactivity disorder services with ongoing work to maintain reduction in wait times and a new neurodevelopmental strategy created with input from multiple partners. We've successfully delivered a far-reaching programme of public health initiatives to help focus on the underlying determinants of health. And this includes the award-winning Farming Fit initiative, which during its first year provided over 750 people health checks across Powys' rural communities. Over 250 organisations have also signed up to the Breastfeeding Welcome Scheme to help give babies the best start of life. And also our work in the digital space, in particular on electronic prescribing and medicines administration, is really now starting to deliver benefits. And we've also put in place a wider use of point of care testing to speed up diagnosis. Through the sterling efforts of the staff, we also ended the year with a deficit 15.8 million plan. This required a relentless focus on reducing our expenditure and back office costs. But although that work was excellent, we do need to take further, deeper and sustained progress to continue to move the organisation forward to a position of sustainable financial balance. A sign of the ongoing financial challenges for the Health Board was the decision by Welsh Government to move us into Level 4 targeted intervention for finance planning and strategy back in November last year. It's important to note we remain in routine arrangements for all of the domains of the framework, and those are really important because it relates to patient safety, operational delivery, workforce leadership and governance. As a consequence of our change in escalation status, we are now working even more closely with Welsh Government, and this has included increased scrutiny and frequency through regular integrated quality performance and delivery meetings with our Welsh Government colleagues. And our escalation to Level 4 requires us to take decisive action to stabilise our position. And you'll hear a little bit later from Pete Hopgood, our Director of Finance, who'll take us through the financial accounts. So the next slide summarises the performance information that you can read in our annual report, and I'm not going to attempt to cover all areas, but I hope you can see the balance of the red and green does give a bit of a quick visual indication of how challenging it has been in the last year to deliver on all of our performance targets, with 25 measures being fully met. We are proud of good performance across a number of areas. In relation to prevention, we continue to prioritise our efforts to continuously improve our vaccination uptake. And we were really pleased we achieved, for example, the target for eligible newborn babies who have a conclusive blood spot screening result by day 17 of life. With regard to primary care, we're pleased that the number of GP practices have achieved all standards for access for in-hours general medical services, and we're really grateful to our GP colleagues who continue to deliver a very wide range of enhanced services supporting our patients in Powys, despite increasing demands. Performance also continues to improve, with the highest performance across Wales for the number of adult patients with diabetes who received all 8 NICE recommended care processes. And back to dental, although we know there's more for us to do, we have increased month on month the percentage of primary care dental services complying with their contract, with compliance at 75% at the end of March, relating to courses of new treatments for new, urgent and historic patients. As a provider of in-county services, we don't have patients waiting over 52 weeks for a new outpatients appointment, and we met the 104 referral to treatment time. We were also compliant with therapy's 14-week target, and we also complied and delivered against the 4-hour and 12-hour targets in our minor injury units. Mental health finished strong at the end of the year with good compliance across the pathways for both children and adults for assessments and interventions, but challenges do remain. For example, in mental health, our care and treatment compliance. We're continuing to further improve on that. And we also remain with diagnostic waiting times being an issue, psychological therapy waiting times, and our focus on reducing waits for children and young people awaiting the neurodevelopmental service. In relation to the services we commission for Powys residents from other providers, including from acute hospitals in Wales and England, a number of challenges remain, particularly around emergency access and ambulance response times, the equity of planned care access across our borders, and in relation to cancer. So firstly, for those patients waiting in commissioned planned care services, long waits remained a challenge. There was some improvement from Welsh providers. However, the challenge of equity remained as there were lower average waits for treatment on NHS England pathways compared to Wales at the end of March 2025. With regard to cancer, performance across both NHS Wales and NHS England has been very challenging, and providers were unable to meet their targets. And with regard to emergency department access, 64.8% of Powys residents spent less than 4 hours in all major and minor emergency care in NHS Wales providers, compared to 47.4% in NHS England providers. So the Welsh Ambulance Service also is commissioned to provide emergency response, and you will see that the emergency response to red calls arriving with up to and including at 8 minutes was not compliant with targets, with 40% compliance achieved against the measure at the end of the year. So I hope this gives you a brief overview of both the operational and challenges that we have faced, including our increase in escalation status, but we're also pleased that we've been able to maintain and improve in a number of areas as well, and we continue to focus on that. Our commitment to our statutory duty of quality continues to be at the heart of our strategy and decision making. Key priorities have included ensuring a focus on our provider services across the Health Board, but also strengthening our review of quality within our commissioned services. So we've revised and strengthened our integrated quality and performance framework, and this really helps us to balance the need to give our staff and our services the space to grow and develop, but also to offer targeted support where it's most needed to help people and the services to deliver against our standards. The framework was enacted during the year. For example, we secured continued improvement in a number of areas, but for example, infection prevention control, mental health and neurodevelopmental services for children were 3 areas of focus. And we also during the year put in place substantial preparation to ensure that the Health Board is ready for the revised Putting Things Right regulations. Whilst we celebrate our progress, we're also focused on the challenges ahead, rising demand, workforce pressures, and the need to shift to a more sustainable model of care. So as we look to this year and beyond, our focus will be on services that does what matters and does what works for the people of Powys, whilst also responding to the additional challenges we face as a rural county. We recognise that the first months of 25-26 have already been challenging in this respect, given the need to implement changes to the way we commission acute care and asking all providers in both Wales and England to deliver treatments and procedures based on NHS Wales waiting time measures. As the year progresses, we do anticipate there are very difficult choices to come, and we're committed to working and having the right conversations with patients, the public, our staff and partners to address the issues we face head on and to also plan for the future. So we mentioned earlier that part of our future planning is being taken forward by the Better Together programme, which is about finding ways to keep delivering quality services that best meets the needs of the Powys population. We really have a clear ambition that we want to continue to deliver safe, quality and reliable healthcare services, and we need to make the very best use of our available resources, but we'll make sure that patient care and safety is at the forefront of everything we do. In recent years, we have experienced lots of changes. We know the demographics of our county means that people are getting older, and as they age, more people are living with multiple health conditions. The legacy of the COVID-19 pandemic still affects some services and rising demand for treatments. And of course, the context economically is that there have been large increases in the cost of fuel, food and other bills that have had an impact too. But Better Together is our work with yourselves, the people of Powys, our staff and our stakeholder organisations to try and develop a plan that meets the needs for the future. We'll need to respond to changes in illnesses and treatment and invest more as much as we can in preventing ill health. It will also look for ways to build a sustainable workforce and to improve our environment, particularly our building and facilities, so that we can meet needs for the future. Since the beginning of the year, we've been in conversations with the patients and with the public, our staff, and with other partners, and we've agreed the initial focus of this work will be on adult physical and mental health services before turning to planned care and then women and children's services in future. And this work is progressing well, with more detailed options being developed. And this means that we expect to begin the next stage of the formal consultation on the future shape of adult physical and mental health community services later this year. So really important that your voices are heard in this and are at the heart of what we do. So please look out for information about this important work. And this future plan and the work that we do has got to be fundamentally based on the partnerships that are absolutely essential in this county, with public sector partners, with community and voluntary organisations, with our staff and the wider health and care system, and also with the people that we serve. There are a number of partnerships within the county. For example, here you can see a number of them, but the Regional Partnership Board and Public Services Board are at the forefront of taking forward priorities across the whole system within the county. But equally important is the work that we do across our borders through regional arrangements and national partnership arrangements to secure the best possible services for Powys. Finally, I'd like to thank everyone for playing their part in the achievements and successes of the year gone by. I know it's not been an easy year, and I'm very grateful for the commitment of everyone to help us overcome the challenges that we face. None of this work would be possible at all without the commitment of our staff, the strength of our partnerships, and without the input of the people we serve. So I'd like to extend my sincere thanks to every member of Team Powys, from frontline clinicians to support staff, volunteers and board members, and to our key partners inside and outside the county for your dedication, for your compassion and continued work to ensure that our services are person-centred and joined up. So I'll now hand over to Pete Hopgood, Director of Finance and Deputy Chief Executive, to present the financial accounts.
Thank you, Hayley. Good afternoon, everyone. So I will take you through the key points from our financial performance on our annual accounts for 2024-25. So first of all, we have three key performance targets. The first one in relation to our revenue position, where we're required to remain within our revenue resource limit as set by Welsh Government. Unfortunately, we failed against this target in 24-25, ending the year with a financial deficit of £15.75 million. In relation to our capital duty, again to remain within the capital resource limit set by Welsh Government, we met this target and delivered a modest surplus of £50,000. And then the final key performance target is in relation to the public sector payment policy, whereby we're required to pay a minimum of 95% of all non-NHS creditors within 30 days of receipt of a valid invoice. Our performance against this target was 93.8%, so unfortunately missed that target by 1.2%. Just moving on to add a bit more detail around that position in relation to our revenue performance. And what you see in front of you is our revenue performance over the previous number of years. We have a statutory duty to ensure that our expenditure does not exceed our aggregate funding over a 3-year period. If you look at the bar chart there, you can see that in 2022-23, we had a deficit of 7 million. In 23-24, a deficit of 11.9 million. And in 24-25 has just highlighted a deficit of 15.7 million. This gives us an overall cumulative deficit of 34.7 million over the 3-year period that relates to. If you look at the table on the bottom of the chart, you can see a breakdown of the total spend on year. And if you look for the 3-year period, we've had total operating expenses of £1.295 billion against a revenue allocation of £1.260 billion, giving us that overall deficit position of 34.7 million. Moving on, please, to capital. Against the capital position, again, we have a statutory duty to remain within our aggregate funding over a 3-year period. This chart again demonstrates our capital performance over that 3-year reference period, in which we had a surplus of 68,000 in 22-23, a surplus of 26,000 in 23-24, and a surplus of 50,000 in 24-25, giving us an overall surplus of £144,000 against the capital position. Again, looking at the table to the bottom of the slide, you can see that over a 3-year period, we have had a total charge against our capital resource allocation of £33.6 million against an allocation of £33.7 million, giving us that surplus of 144,000. So just to pause, it highlights the significant level of spend that the Health Board discharges in relation to providing the services it does for the population of Powys and in ensuring that they receive the healthcare that they require. If we move on, please. In relation to the public sector payment policy and the requirement to pay 95% of all non-NHS invoices within 90 days, just as highlighted on the chart there and highlighted in yellow, our performance in terms of number, we paid total number of bills paid of 52,868. That's number of bills, and the number within target 49,586, giving us a performance of 93.8%. This is an improvement on last year, but still not quite to that 95% level that we're working hard to deliver and will be a focus in this financial year. If we move on, please. So really, this is just giving a breakdown of where do we spend our money? Where's our key areas of expenditure? And really, we can break those down over 3 key headings. The first area being primary healthcare services, whereby against our total spend in 24-25, we spent 83.495 million. Our expenditure on healthcare from other providers, that's the care that we commission or purchase from our other providers, that was 246 million. And in relation to our expenditure on our own hospital and community health services, that's just under 152 million. So in total, our spend in 24-25 of 481 million, when adjusted for income and some other adjustments, gives us our net operating costs for financial year of 464 million. Move on, please, Liz. The next few slides really break down against those 3 key areas of spend. So where do we spend our money in those categories? And what you have on the slides is our total spend in percentage terms and in spend in 24-25 and how that compares to the previous year in 23-24. So this is our primary healthcare services. And in the pie chart, this breaks us down across general medical services, pharmacy services, general dental services, general ophthalmic services, other primary healthcare expenditure, and prescribed drugs and appliances. The first thing to note is that if you look at the two pie charts, even though their size is slightly different, you can see that the general breakdown between the slices within the pie are broadly similar, meaning that our spend against the categories has remained broadly the same. The blue area of the pie chart, the biggest area spend against our primary healthcare services, this is in relation to general medical services, whereby in 24-25 we spent 44.8 million, and that was 54% of the total spend in primary healthcare services. The next biggest area is in relation to our prescribed drugs and appliances, and in this area we spent just at 22.9 million, which is 27% of the total spend. And as I said, the other categories are included, and as you can see, the general spend profile is very similar to the previous year. Can move on, please. The second area is our healthcare that we commission or purchase from our other providers. Again, the same format whereby the pie charts are there to help understand the breakdown of that spend within this category and how it compares year on year. So what you have in these diagrams includes our spend within NHS Wales, our spend with non-Welsh NHS bodies, and the main that will be our English providers, our spend on specialist services and ambulance services, with local authorities, voluntary organisations, complex care and continuing healthcare, including FNC, and then a general categorisation. And as you can see against the pie chart there, that the most significant or the highest spend area is with our non-Welsh NHS bodies. That will be with our in the main our English providers, where in 24-25 we spent just over 82 million, which accounts for 33% of the spend in this category. Other significant areas just to highlight is that in terms of the blue area there, that's our spend. Sorry, the slightly lighter shade of blue is our spend in NHS Wales, which was circa £55 million, 22% of that spend. And then in relation to our specialist services, including ambulance services, which is the grey area. Also noting another area of spend in relation to complex care and CHC, which is the green part of the diagram, and in 24-25 accounted for £35.8 million and 15% of our spend in this area. If we move on, please. And then finally, against our own hospital provided services and our community services, the diagrams again in a pie chart format, hopefully make it easier to compare year on year. Again, the level of spend is broadly similar in percentage terms. And then the biggest area there, which is not surprising, is our spend on pay, our salaries. So the blue area is our spend on pay, and the most significant area of spend. So in 24-25, our total spend on pay was 128.6 million, accounting for 83% of this spend category area. If we move on, please. So every year the Auditor General and Audit Wales audit our accounts in relation to our failure to meet our duty to remain within our revenue limit by, as I highlighted, exceeding the revenue resource limit by 34.7 million over a 3-year period. Our accounts have been qualified on a regulatory basis by the fact that we did not meet that target. That is deemed to be irregular expenditure because it's a deficit position, hence the qualified opinion. However, we did receive an unqualified opinion in relation to the true and fair view of our accounts. This means that our accounts are accurate with no material errors and that they can be relied on. If we move forward, please. So in summary, the Health Board met one of its 3 statutory targets in 24-25, did not meet the revenue resource performance target, did meet the capital resource target, and did not meet the requirement for an approved 3-year INTP plan. The Auditor General issued an unqualified audit report on the financial statements for true and fair opinion in 24-25, as highlighted on my previous comments on the slide before. And for 25-26, an annual plan was submitted to Welsh Government on the 31st of March 2025. So that is the summary of the financial performance and the financial accounts for 24-25. I'll now hand over to Helen Bushell. Thank you, Helen.
Thanks, Pete. Thanks very much for that, and to Hayley as well. So we've now reached the time where there's an opportunity. We've received some questions from members of the public and also some stakeholders. So thank you ever so much for those. I'm going to read those out in a moment and invite colleagues to provide some response to them. There is still some time though. If any of you on the call do want to ask anything, please use the Q&A, the question and answer tab along the top right hand side of your screen. And even if we don't get to them today, we will still provide a response back on our website. So still a little bit more time if anybody does want to provide any further questions, and we really encourage you to do that. So I'm going to come first of all then to a question for Claire Roach, our Executive Director of Nursing Quality, Women and Family Health. And Claire, we've had a question from a colleague at the RCN, the Royal College of Nursing. And the question is, the annual plan says agency staffing accounts for 9.5% of the total pay budget in Powys versus a Wales average of 2.8%. What are the specific 2025-26 milestones to cut agency reliance, and how will you support recruitment and retention, including our Grow Your Own and overseas, whilst of course maintaining safe staffing in practice? Thanks, Claire.
Thanks, Helen. Good afternoon, everybody. So it's an excellent question, and thanks to my RCN colleagues for posing this. So during 25-26, we have established specific governance arrangements for the gradual cessation of agency use. This work is being led by the Exec Director of Community, Primary Care and Mental Health, Elaine, but supported by myself and Deborah, our Director of Workforce. We've taken a phased approach. This commenced on the 30th of June with no off-contract for healthcare support workers, up to the 25th of August, which resulted in no off or on contracts for healthcare support workers. And in July, we had 2 dates that focused on the cessation of off-contract registered nurses and off-contract registered mental health nurses. However, for this process, we have had escalation criteria agreed, and that is to ensure that safe staffing is maintained, and we have a robust approval process for approving the use of agency. We continue to work with university partners such as Aberystwyth and South Wales universities, and we remain firmly committed to our Aspiring Nurse programme in Powys, which Hayley referred to in her presentation. And with the support of HCIW, we're not only securing that future pipeline of registered nurses, but as Hayley said, also making sure we've got meaningful opportunities for people in rural Mid Wales to pursue nursing careers. Our international recruitment programme has been highly successful, and we have welcomed over 37 skilled nurses from overseas to date. That has stabilised ward areas that were experiencing particularly high vacancy levels. And looking ahead, our first cohorts from the Aspiring Nurse programme will qualify in 2026 next year, absolutely marking the beginning of a consistent pipeline of registered nurses progressing within Powys. From a retention perspective, initiatives such as restorative supervision, wellbeing offers within the Health Board, and our focus on the National Nurse Retention Plan published by HCIW are just a few examples of how we are ensuring that nurses who work in Powys have fulfilling careers and ultimately, we hope, stay with us. Thank you, Helen.
Thanks ever so much for that really helpful answer, and I hope that gives our colleagues the information they were seeking anyway. So next then, we've got a question from a member of the public in Builth Wales. So Nicola Johnson, our Executive Director of Planning, Performance and Commissioning. Again, I'll just read out the question. I'll read it in full just to make sure that we've reflected it properly, and then ask you to comment, Nick, if that's okay. So when neighbouring health boards have a consultation regarding the removal or change of services from a hospital, do they consider the impact to patients from Powys as well as those in their own area? The extra travel time for Powys patients is immense. It's hard enough to travel to Hereford, Shrewsbury, Aberystwyth, Merthyr or Abergavenny. The closure of A&E at Abergavenny massively affected many Powys residents. And the downgrading of certain services at Hereford and Aberystwyth hospitals will again massively affect Powys patients. When those health boards look at travel times for moving services, do they factor in Powys travel times? Thanks, Nick. Over to you.
Thank you, and thank you for the question, Alison, if you are watching or if you are listening, and really important, and a question or a comment that we do get frequently when we talk to people that live in Powys. We know that our population is dispersed and rural, and transport is a real issue, particularly where people are reliant on public transport, but even using their own transport, the travel times are an issue for our population, and again a topic that comes up frequently when we talk to people that live in Powys. We know that our population travel for large parts of their NHS care, and particularly when it's reliant on specialist care or hospital care, and that means travelling outside our borders for that specialist care. And that could be to other Welsh health boards, or it could be to trusts in England. Both the trusts and the other health boards have a duty to consider the impact on the populations that they serve. That could be their resident population or our population, or indeed populations of other health boards where people travel across those organisational boundaries. And as a health board, we also have a responsibility to advocate for our population, to liaise with those other organisations and ensure that engagement opportunities are available. We do in that consider and assess with those organisations what the likely impact is, and how many people and so forth would be impacted, and therefore those engagement opportunities are designed to be proportionate to that. So, for example, an example Alison herself has used, however, just engaged and consulted on changes to their services, and in conjunction with however and us, it was arranged to have a face-to-face engagement opportunity in the north of Powys, as well as for people to be able to put their comments in either digital or in writing. And Ira and Bevan are in engagement around a change to their stroke rehabilitation services. We've assessed jointly it's unlikely that that will affect many of our patients, because although patients go from South Powys to an Ira and Bevan for the acute stage of their stroke care, our pathways and our preference has been for quite a long time for the rehabilitation to be within Powys anyway. So just two examples there, with sort of differences of the approach depending on the impact. But a great question from Alison, and we do, as well as our partners, really understand the impact of the transport issues on our rural population. Thank you.
Great, thanks very much, Nick, for that. And Alison, I hope that recognises some of the points you've made and gives you some examples and some response back as well. So thank you again for that. Okay, I'm going to go then to another question from a colleague at the Royal College of Nursing, then the RCN. And Claire, I'm going to come back to you if that's okay. The question is, how will the risk recovery sustainability actions, and just to put those in context for everybody else, they are the three themes of actions that are highlighted within our annual plan, and you'll see that in our annual report and some of the documents online. So how will those actions, Claire, safeguard frontline nursing, and what guarantees can you give that budget pressures will not lead to an erosion of nurse staffing or patient safety? Thanks, Claire.
Yeah, thanks, Helen. And again, thanks to colleagues in the RCN for asking this question, which is, really important. So what I would say is that as the health boards, we are compliant with the Nurse Staffing Act. Our staffing levels support our nurses to have sufficient time to care for patients sensitively. Our staffing levels are reviewed and agreed by myself annually. These are monitored and indeed in the main, they are maintained. Any deviation from safe staffing is instant reported, and our Nurse Staffing Act annual paper is set to go to board later this month and will provide assurance to the board of the effective arrangements in place within the Health Board to adhere to the Nurse Staffing Act. As explained in the previous question, as we seek to reduce our use of agency and temporary staffing, we have adopted a robust risk-based approach to this, ensuring that patient safety and safe staffing is our core priority. Thanks, Helen.
Lovely. Thanks ever so much, Claire. Appreciate that. And then Deb Wood-Lawson, our Executive Director of People and Culture and Transformation, going to come to you with a question again from a colleague from the RCN. Deb, if that's okay, and I'll just read it out again for you. So RCN members in Wales recently rejected the 3.6% award and continue to campaign for fair pay and safer working conditions. What's the board's plan to work with trade unions locally on pay and conditions, bank and agency usage, rostering, violence reduction and security? And how will you publicly report progress against these workforce metrics through 2025-26? Thanks, Deb.
Diolch. Prynawn da, everybody, and thank you so much for the question. The Health Board works really closely, both locally and nationally, with its trade union partners, and we are aware of the outcome of the national RCN ballot. The Health Board has strong relationships with the trade unions informally and then more formally through its local partnership forum. The local partnership forum meets regularly and provides the opportunity to discuss a wide range of matters, which includes our workforce performance against our annual plan, our work on improving bank usage and the filling of our vacancies, all as an alternative to higher cost agency booking. And the local partnership forum also considers matters relating to health and safety. Public reporting of workforce metrics are considered by the board as well as the relevant committees. For instance, the Finance and Performance Committee and the People and Culture Committee. The next meeting of the People and Culture Committee, on the agenda, there is my director report, which includes a broad update across my portfolio and within that an update on our variable pay actions as outlined by Claire Roach earlier. There is a separate performance report setting out our progress against our workforce metrics and a deep dive into violence and aggression, looking at trends, reporting and training. And just as a reminder, all details and papers for committees and the board are in the public domain and therefore available to all. I'll hand back to you, Helen. Thank you.
Deb, thank you. Thanks ever so much for that. And again, colleagues from the RCN, thank you for your questions and hope we've been able to answer those for you as well. So I'm very conscious of time. We're running over the prescribed time a little bit, but we have had one other question that's in the chat. And the question is, does placemaking feature in your various strategies? And I'm just looking around the room. Hayley, I don't know if you want to make any comment on that or if it's something that we may need to publish an answer to following the meeting. But Hayley, I'll come to you for any comments you might have. Thank you.
Yeah, thank you, Helen. It's really interesting because the definition of place, we plan on a county level, we plan at a community level as well. But in particular, that principle of how do we create vibrant, people-focused spaces where, we're looking at social, physical, infrastructure, all of those things on a place-based basis is something that definitely is a feature of our discussions, both in relation to how we work as a health board, in recognising that we need to recognise the vibrant but very different communities we serve in Powys. But also how we engage particular communities and how we then build and design with those communities changes. And we're doing that on a footprint, which is whole system, Helen. So in particular, the Public Services Board, the work that we do with the Regional Partnership Board, we take a place-based approach in relation to how we plan some of those services. So we plan on a county level, we plan on a cluster level, and we plan also on a local level. And I think particularly, we haven't covered today, but you'll see some of the work in the annual report around the work that we've done around community benefit, but also the environmental and economic sustainability side of things. We've got a very, very important role as a health board in the foundational economy, but also on the environmental stuff, we set very clear work around how we're tackling the climate change emergency at an organisational level, but also at a system level when we're working through Public Service Board and Regional Partnership Board planning as well. So yes, it definitely features, and it's an important component of how we work together with the local authority, PAVO and other partners to address what's important for our communities, because they're all quite different. We're all rural, we're a rural county, but it's really important that we take that hyper-local approach to the discussions when we're talking about delivery of services. Thanks.
Hayley, thank you. Thanks ever so much for answering that. And I hope that answers the question that the person had asked us as well. So, Carl, just before I hand back over to you then to conclude today's AGM, can I just say a very big thank you to everybody that's asked questions of us. I hope we've given you the information that you were seeking or required. If we haven't, please come back to us. And thank you ever so much as well to the my colleagues around the board table that have provided those answers as well. Just to say, it's not only the AGM where you can ask questions of us. We've always got open channels where we're keen to hear from anybody across Powys, members of the public, patient service users, and of course partners in Powys and further afield as well. We do run our in-public board meetings, and we do on our website have some information about how you can ask questions of the board at any point through the year, and we'll always come back and provide a response to you on that as well. So please keep any questions coming in that you may have, and we will get back to you. So Carl, I'll hand back over to you. Thank you ever so much. Diolch.
Thank you, Helen. So it simply remains now for me to echo and reinforce some of the acknowledgements and expressions of gratitude that have been made during this meeting. And first and importantly, foremost, to staff colleagues across Powys Teaching Health Board who work tirelessly, as I said, day in, day out throughout the year to provide high quality health services with and for the people of Powys, without whom none of this would happen. So thank you. Also, a big thank you to my board colleagues, both independent colleagues and executive colleagues, for your time, your expertise, and your very wise counsel as we navigate what is an increasingly complex landscape, but one that we are determined to continue to navigate in the service of our population. And we also acknowledge, as Hayley mentioned earlier, that as a board, yes, it's been a challenging 24-25 year, but those challenges haven't gone away, and some very difficult issues and decisions are ahead of us. But I also wanted to give this public commitment and public assurance in this annual general meeting that we will continue to work conscientiously and diligently with and for our population as we fulfil our duties and responsibilities. Felly, diolch o galon i'n staff, I gydweithwyr ar y bwrdd, ac I bob un ohonych chi am fynech chi heddiw. Thank you to everyone who's attended today. But for now, thank you, have a good rest of the day, and goodbye.